Good morning, villagers. We're coming to you this morning from the beautiful city of Scottsdale, Arizona, and I have the pleasure of talking with Hudson Staffield, who is one of our Village medical patients. So good morning, Hudson. How are you this morning?
Good morning, Paul. How are you?
Pleased to have you in today.
Thank you.
So how did you come to be a patient of Village Medical? Well, how did that happen?
When we moved to Arizona 6 years ago, I had to replace my medical care. So I began to look, and I just came across Honor Health, and I checked their office to see if they were taking new patients, and the doctor that they recommended was retiring. And they said, but we've got this new fellow. And I said, I'll give it a try. And if it doesn't work, we'll try something else. But as it turned out, it worked very, very well.
And so, and who is the mystery doctor that you were working with?
Well, the mystery doctor is Jared Berkowitz.
Okay. So Dr. Berkowitz joined us from Honor Health, right?
That's right.
So that means you followed him.
I did. When he moved, I thought, well, let's see, there must be a new environment. I wonder what that's like. I'll test that, but I'll rely on him to have good judgment. I asked him, why did you do that? And he said, they seem to be more interested in patient care. I said, well, that's why I'm here.
And how's it been? How's the experience been since you joined us?
It's been seamless. It's effortless. We get there quickly.
Yeah. When you and I were talking earlier, you mentioned this idea that you had some health issues and that you needed an advocate and somebody to kind of quarterback what was happening with you. Just describe how that works.
I was talking to one of my physicians, Paul, and he said, Hud, you're complex.
Said, so there's that that's
you're
in the way.
You're not the first person to say that.
Right.
But no, I found out later in life that I do have allergies. I have asthma, and I had some heart issues. I had a pacemaker put in. And so it takes a bit of coordination between somebody who's got your primary care and the other people who are coordinating with that. They have to talk.
Right, right. And do they?
They do, because the point man is, in this case, Dr. Berkowitz.
Right.
He knows some of these other physicians after having gotten to know them. And so if an issue comes up, they coordinate. Cardiologist does, pulmonologist, allergy guy, infectious disease person, and he coordinates that care. Now, if there is something missing, I can literally text him or call him.
So you have that access to him? Text, call?
Yes, he's permitted that. I don't abuse it.
So it's personal.
It is. It's very personal, and that's reassuring.
So to me, that feels special. I wish I could say I had the same rapport with my primary care doctor, who's been my doctor for 21 years. He's part of a health system in Chicago, and I don't get that same level of engagement.
Well, it gives me peace of mind to know that I have a strong advocate, because that's what most of us need in navigating this healthcare arena now. You need somebody to help shepherd you through.
Yeah, so you've got a care team, it's integrated, coordinated, you've got a quarterback, or at least an advocate, right?
Yeah.
And then you had a switch where you were going for care from Honor and a location to a co-located clinic similar to the one that we're in today. How do you like the clinic itself?
I think it's more personal. It gives the impression that somebody has designed an office to make it comfortable for you rather than be more institutional in nature. I like that.
Do you have a spouse? Do you have children?
I'm married 52 years.
Congrats. That's a feat in itself.
Yeah.
Beautiful.
Married to Cynthia. She's also a patient with Dr. Berkowitz.
Nice.